Gentlemen, easing an enlarged prostate and reducing post-urination dribble can start with something as simple as drinking water the right way. I know it sounds almost too basic. You want less urgency, fewer nighttime bathroom trips, a cleaner finish after you pee, steadier energy, and better confidence. This method costs nothing, fits easily into any routine, and you can begin immediately. You've heard drink more water for years, yet no one has ever shown you how to hydrate specifically for prostate health. Prostate-focused hydration is different from general hydration. The timing, the quantity, and even the temperature matter. When done correctly, it can calm irritation, improve circulation in the pelvic area, and reduce leakage. I'm Dr. Catherine Rocker, a urologist with more than 20 years of experience treating men with urinary urgency, weak stream, post-void dribble, and nocturia, meaning waking up at night to urinate. My work centers on simple habits that create reliable improvements, and hydration strategy is one of the most effective tools I teach. Here is the foundation in clear, straightforward language. The prostate surrounds the urethra, the tube that carries urine out of your body. When you don't drink enough, your urine becomes concentrated. Concentrated urine irritates the bladder lining and the outlet near the prostate. That irritation triggers urgency and causes the outlet to tighten. At the same time, low fluid intake thickens the blood, reducing smooth circulation to the pelvic floor muscles responsible for stopping those last few drops. Hydration influences three key factors related to BPH and dribbling: the concentration of your urine, the tension of the outlet muscles that open and close during urination, and the thickness of your blood. Even mild dehydration can push all three in the wrong direction. Small mistakes add up quickly. Relying on thirst doesn't work. Thirst is a delayed signal. By the time you feel it, irritation has already started, your energy has dipped, and the outlet is tighter than it should be. A proactive approach works far better than waiting for your body to sound the alarm. And there is real urgency here. When you're underhydrated, your body prioritizes your heart and brain first, leaving the pelvic organs with less support. This shows up as hesitancy when starting to pee, a weak stream, stop-and-start flow, and that final drip that stains your underwear. The good news? These symptoms can improve quickly. Change how and when you drink, and many men notice less burning, smoother flow, and fewer bathroom visits within days. I've watched men in their 50s, 60s, and 70s regain control with smarter hydration alone. One patient of mine, Leon, age 63, began each morning with a warm glass of water, took small sips hourly, and had his last full glass early in the evening. Within a week, he reported a stronger stream and a clean finish. 2 weeks later, he slept through the night for the first time in months. No supplements, no new medications, just strategic hydration. If you believe water can help your prostate when used properly, type yes in the comments. If you're unsure, type 0. Your feedback shows other men they aren't alone and helps me guide you more effectively. Now let's talk about the first mistake. A mistake more than 80% of the men I meet make before breakfast. I call it a shotgun start. This happens when you grab your morning coffee or tea immediately after waking, skipping water entirely. I understand the routine. You want that burst of energy. But here's what really happens. After 7 or 8 hours without fluid, you wake up naturally dehydrated. Your body has used water overnight for essential functions and is craving replenishment. When you introduce caffeine first, you give your system a diuretic. This forces your kidneys to expel even more water. Instead of refilling your tank after a long night, you're punching a hole in it, losing even more fluid. This early dehydration directly affects your prostate and bladder. Your body produces urine with the limited water available, resulting in a highly concentrated, acidic fluid. Think of it like applying a harsh chemical to sensitive tissue. As it passes through the bladder and over the prostate, it aggravates both. For an enlarged or inflamed prostate, this feels like pouring lemon juice on a cut. It sparks urgency and a lingering sense of discomfort. Many men notice their symptoms are worst in the morning, and this habit is a major reason why. Your morning coffee ritual may be setting the tone for a day full of irritation. So here's the correction. Before brewing your coffee, drink a full glass of water. Give your body the hydration it waited for all night. This single step restores blood volume, dilutes your urine, and soothes your bladder and prostate instead of stressing them. Many patients tell me that just this adjustment dramatically reduces their morning urgency within days. Your body is asking for water. Start by giving it what it needs most. The second mistake I see constantly is what I call the desert to flood pattern. This is when you barely drink water all day. Maybe you sip at lunch, and then try to catch up by chugging 2 or 3 big glasses late in the evening. It feels logical, but your body doesn't work that way. This pattern creates 2 problems at opposite ends of your day. During the desert, your body experiences a long drought. Your urine becomes thick and concentrated, irritating your bladder lining and constantly aggravating the prostate. This leads to stronger urges, more frequent daytime visits, and burning discomfort. Then comes the flood. You take in a large volume of water right before bed. Your kidneys rush to process it, filling your bladder rapidly. For men with enlarged prostates, this is a disaster. The bladder already struggles to push urine past the obstruction. When it's overfilled at night, powerful signals wake you up, sometimes 2 or 3 times. Each interruption disrupts deep, restorative sleep. One patient, Michael, lived in this cycle for years. Afternoon irritation followed by nighttime chugging, guaranteeing poor sleep. The cure for his problem turned out to be the cause. The fix? Break the cycle. Instead of desert then flood, aim for steady, gentle hydration throughout the day. This keeps urine diluted and calm, protects your bladder during the day, and allows restful sleep at night. The third mistake comes from good intentions, but backfires badly. The morning fluid overload. This happens when a man tries to improve his health by drinking a full liter of water immediately after waking. It sounds sensible. If a little water is good, a lot must be better. But for a prostate that's aging, this sudden rush overwhelms the bladder. The bladder is a muscle with limits. Forcing it to hold a huge volume all at once overstretches and fatigues it. This is especially harmful when the bladder already works harder due to an enlarged prostate. A patient named Mark did exactly this. Determined to flush his system, he chugged a large amount of water every morning. Instead of feeling better, he developed a nagging sense of incomplete emptying, more frequent urges, and a weaker stream. His bladder was stretched and unable to contract efficiently. A pool of leftover urine increased irritation and even infection risk. When he switched to steady sipping, his symptoms calmed within days. Your bladder works best when you don't shock it. A huge morning chug is not a cleanse. It's stress. A gentle, consistent approach keeps your bladder relaxed and your prostate calmer. The fourth mistake is simply waiting until you feel thirsty. Thirst is a late warning signal. For men over 50, this delay becomes even more pronounced. You can be dehydrated for hours before thirst kicks in. During that time, your kidneys concentrate your urine into a strong, acidic fluid that irritates the bladder and pressures the prostate. This hidden dehydration also reduces energy because low water intake thickens the blood, slowing circulation. Many men blame afternoon fatigue on age or hormones, when it's actually poor hydration habits. The fix is simple. Don't wait for thirst. Drink consistently throughout the day. Prevent the crisis instead of responding to it. Now that we've covered the mistakes, let's build your new routine. These are the straightforward strategies I give my patients, strategies that often improve urinary comfort and sleep within just a few days. Begin your morning with a warm glass of water, about 300 to 400 milliliters. After a night without fluids, your body wakes up slightly dehydrated and your bladder is most sensitive. Warm water gently restores balance without overwhelming your system. I call this habit the warm lemon reset. Within 20 minutes of waking, drink warm water with a squeeze of lemon. The warmth relaxes pelvic muscles and wakes your digestive system gently. The lemon's natural citrates help reduce urine acidity. From your first bathroom visit, you send a calmer, less irritating stream through your bladder and prostate. If lemon irritates your bladder, skip it or add only a tiny amount. Hydration is the key. Extras are optional. Many of my patients say this single change makes their first morning urination noticeably easier and less urgent. The second strategy is what I call steady sipping. This is the solution to the desert to flood pattern. Keep a water bottle with you, and take small sips throughout the day, about 4 to 6 ounces each hour. This keeps blood volume steady and ensures you produce mild, diluted urine, which your bladder and prostate prefer. This also means adjusting evening habits. Finish your last full glass at least 45 to 60 minutes before any activity where comfort matters, social events, intimacy, or bedtime. This timing keeps you hydrated without burdening your bladder. The third strategy is the afternoon swap. When fatigue gets around 2 or 3 p.m., drink a full glass of water instead of reaching for more caffeine. That slump is often dehydration, not a lack of caffeine. Water restores alertness naturally. Afternoon coffee increases dehydration and leads to concentrated urine, fueling late-day urgency. One of my patients, Ramon, followed this pattern. Afternoon espresso, followed by a bathroom sprint and difficulty sleeping. Switching to water first transformed his energy, reduced urgency, and improved his sleep. Try it yourself. At the next afternoon slump, drink water and wait 15 minutes. Most men feel better without caffeine. If you still want something warm, choose herbal tea. These steps form a strong foundation. When paired with prostate-supporting nutrition, like lycopene-rich foods such as tomatoes, watermelon, pink grapefruit, guava, or papaya, you create a powerful synergy that supports long-term prostate health.